Hello, my dear pharmacists. This is Professor Komal. In this video, we'll see the mnemonics or easy tricks for the arrhythmia or anti-arrhythmic drugs, which is included in your drug inspector syllabus 2025, and which is cardiovascular disease. We'll see the mnemonics or easy trick for the anti-arrhythmic drugs. Before going through the mnemonics or easy trick, first we discuss the what is the arrhythmia. Arrhythmia is the it is also known as the cardiac arrhythmia, which shows the irregularity in the heartbeat, or an arrhythmia irregular heartbeats where the heart beats too fast, that is tachycardia, or too slow, that is bradycardia. uh, or we can say that the electrical signals that says the heartbeat is heart to beat not work properly. Okay, now we'll see the and what is the anti-arrhythmia. The drugs which is used to treat the arrhythmia is known as the anti-arrhythmic drugs. We'll see the classification or easy trick for the anti-arrhythmic drug. There are main four class and last one is the other drugs. Okay, मेन 4 क्लास आहे त्याच्यामध्ये. एक एक आपण बघूया कोणकोणते क्लास आहेत. तर फर्स्ट क्लास 1, क्लास 2, क्लास 3 आणि क्लास 4. अँड क्लास 1 आहे तो अगेन डिवायडेड इंटू 3 टाइप्स. द फर्स्ट क्लास 1 विच इज द सोडियम चॅनल ब्लॉकर्स, और त्याचंच आणखी एक नेम आहे मेम्ब्रेन स्टॅबिलायझिंग एजंट. सेकंड क्लास सेकंड इज बीटा ब्लॉकर्स. Class 3 is the potassium channel blocker. Class 4 is calcium channel blockers, and last one is the other drugs. The first class for the main classes, the trick is the some black color potassium channel dam. Okay, some for sodium channel block for beta blockers, then potassium for potassium channel blockers, channel for calcium channel blockers, and dam. ऑदर्स जे आहेत तर त्याच्या एक्झाम्पलवरून डॅम घेतलेला आहे. ऑदर डॅम डी फॉर डिगॉक्झिन, ए फॉर ॲट्रोपिन, एम फॉर मॅग्नेशियम सल्फेट. ओके, then we'll see the first class. First, sodium channel blockers or membrane stabilizer, which is again divided in 3 class. Class 1A, class 1B, class 1C, which class 1A is immediate effect, class 1B is moderate effect, class 1C is slow effect. Example for the class 1 is quinidine, procainamide, and disopyramide. Then second class 2, class 1B for example is lidocaine and mexiletine. For the class 1C, the example is propafenone, plecanide, morizicin, and inakinide. Okay, for the this class क्लास 1 साठी ट्रिक आहे. क्वेश्चन पेपर में डाउट है, लेट मी आस्क द प्रोफेसर. ओके, तर एक्झाम्पल कसे लक्षात ठेवा. क्वेश्चन पेपर में डाउट है, लेट मी आस्क द प्रोफेसर. फर्स्ट क्वेश्चन फॉर क्विनिडिन, पेपर फॉर प्रोकेनामाइड, डाउट फॉर डायसोपैरामाइड, देन हे लेट फॉर लिडोकेन, मे फॉर मेक्सिलेटिन. The next is ask professor for propafenone, and professor for plecanamide. Okay, the next class 2 is beta blockers. For the beta blockers, the trick is MAP. M for metoprolol, A for atenolol, and P for propranolol. Then next class 3 is potassium channel blockers. For the potassium channel blocker, the trick is SAD, drug inspector. Okay, in SAD, S for sotalol, A for amiodarone, and D for dronedarone. And drug inspector, drug for dofetilide, and inspector I for ibutilide. And next class is the class number 4, the calcium channel blockers. The trick is VD, Virat Dhoni, verapamil, and diltiazem. Last is the other drugs, digoxin, atropine, magnesium sulfate. This is the easy tricks or mnemonics for the anti-arrhythmic drugs, which helps in the treatment of the arrhythmia. Now we'll see the mechanism or pharmacology in detail of class 1, which is the membrane stabilizing agent or sodium channel blockers. Okay, sodium channel. The first, class 1A drugs, which is quinidine, procainamide and disopyramide. The mechanism of action for this class 1A for block voltage gated sodium channel in their activated state, and which decrease the atomicity, conduction velocity and prolong repolarization. Then route of administration for this drug is oral as well as intravenous. Indications are ventricular, supraventricular arrhythmias. Contraindications: heart block patients, then sinus SA dysfunction patients, cardiogenic shock patients. And adverse effects is nausea, vomiting, hypersensitivity, thrombocytopenia, agranulocyte, idiosyncratic reactions, hepatitis and hypotension. And the high dose of the quinidine, procainamide, which cause the synchronism like quinine. And uses are atrial and ventricular arrhythmia, which is the types of the arrhythmia. Then class 1B, the drugs are lidocaine and mexiletine. Mechanism of action is which blocks the voltage gated sodium channel in refractory state and decrease the action potential. Route of administration is for the lidocaine, which is only given intravenously, and mexiletine, which is given intravenous as well as oral. Indications: ventricular arrhythmias. Contraindication: should not given with SA node disorders and AV block. Adverse effect: hypotension, bradycardia, drowsiness, confusion, convulsion and paresthesia. And last, class 3, the drugs are flecainide, propafenone. Mechanism of action which blocks the sodium channel in open state, resulting in the reduction of excitability of myocardium. This delays conduction. Then route of administration: oral as well as intravenous. Indications: ventricular tachyarrhythmias. Contraindications: heart failure, history of myocardial infarction. Adverse effect: dizziness and visual disturbance. And the uses which is used in atrial and ventricular arrhythmias. Okay, this is the class 1 pharmacology. Today we'll see the only classification trick, mnemonics tricks for the antiarrhythmic drugs, and class 1 pharmacology of class 1 drugs. Thank you.